Mark, thank you very much. Welcome to Good Chat.
Yeah, thanks for having us.
Great to have you. And for those of you that don't know, you've been in the health industry for many, many years. In fact, my mother was just here and you said you worked with her as well. So this is something you've been in for your whole life.
Yeah, well, not my whole life. I had a life before I became a nurse, but I often say I was privileged to start my working career as a mental health nurse out of Brierly. So I had that kind of comparison between institutional care to community care. And I think that has really enriched my understanding of the two sort of models, if you like, but also going from a kind of protected environment like Brierly was to then going out into the community was where I faced a lot more issues, particularly around substance use with people with major mental illness, and that kind of led me down this whole journey into drug and alcohol. And, you know, many years down the track, this is where I am now, working in drug and alcohol. And
just on Brierly, I know like my mother and father worked there. I grew up going and visiting them there. When that facility closed, it was such a hit, wasn't it, to the way mental health was treated in Warrnambool and indeed the wider southwest.
It was a huge change, you know, and for the whole community to adapt to. I think, it was a very contained, controlled environment to then sort of moving it out into the community and to have the access to beds, and for people with particularly chronic and persisting kind of presentations, that become an issue into finding, you know, safe and secure housing. You know, as I say, with the drug and alcohol issues, I guess they became more prevalent and more problematic. And so I think over the years we've probably seen a more complex presentation now as a result of that, which is why services like ours and mental health services really need to step up to that integrated care model where we really embrace working with people that have both mental illness and a substance use disorder.
Yeah, and I think one thing that I find surprising every time I talk to my father in particular about mental health and the way Brierly was, is a lot of patients in Brierly were sometimes they were people with disabilities that are very capable to do things in the community, but back then they were thought that was the only way that they could actually live their lives. It's such a contrast now, because luckily we've come so far and we've got so many great community members with all abilities. But back in those days, it was a different way of looking at not only mental health but disability.
Complete lack of understanding, really, wasn't it? And I think, you know, it was this idea of housing people away from community, which you're absolutely right. I mean, what we know, particularly in mental illness and in substance use, connection is far greater than isolation, you know. And so when you remove people out of the community, you're taking away a whole incentive to be a part of the community. And I think we've learnt so much more, and we're, you know, developing better models. And I suppose within that, research is continuing to improve as well. So the treatment options we have to provide people are so much greater than what we had back in the old Brierly days.
Well, take us back to the when it actually closed its doors. Was it a huge culture shock to Warrnambool and indeed the patients? Because all of a sudden people are actually back out in the community that might not have been equipped to be able to live in the community. There's much better things in place now to help with that. But was it a huge, I guess, shock to the system for everyone involved?
I don't know about... It was definitely a shock when it gets announced, but then there was a whole tapering plan towards reintegrating people back into the community. So there were definitely some patients that were institutionalised, for want of a better word, and really liked the confines and the security of being in the Brierly. And for them, I think adjustment was a really big issue, but for others, it was kind of a welcome thing as well. And I think similarly for staff, there were some staff that really could see the benefits of a changed model, and there are other staff that found that really difficult and confronting. So,
do you think now, looking back in hindsight, it was a great move to be able to reintegrate some of these people back into the community?
On the whole, absolutely.
Yep.
I mean, it definitely was a better model of care, because we're actually offering treatment. Really, back then we weren't really offering treatment. It was more contained environment sort of stuff. And I think that's been the big win. I think the thing that happened when we deinstitutionalised is that a lot of money goes into running an institution.
Yeah.
And the hope was that all that money would stay protected within the mental health treatment stream, and it wasn't the case. And obviously governments are always stretched for money all the time. And I think if we had a more financial mental health and drug and alcohol kind of model, we could probably deliver greater care. And I think that's where some of the challenges we see now today with some people that are struggling with homelessness, struggling with chronic persistent symptoms of their illness, that sort of stuff. I think we need to be looking at what sort of models of care can we offer in that sort of environment. NDIS is one of those things, but as we know, there's a lot of challenges with the NDIS model.
Yeah.
So I think it's constantly going to evolve, and we've just got to keep advocating for the needs of people.
And I think just on that note, there's always going to be vulnerable people living in the community, and I guess any agency or healthcare provider, WRAD or anyone, needs to have their best interest in hand, and I think that's certainly what's happening. The segue into mental health, your role with Let's Talk. I know John Parkinson and you go way back. He was one of the founders of Let's Talk, and I think now, as someone that's obviously followed Let's Talk's journey over the journey and been very open, I've got my own mental health battles that I've been very public about. Tell us about the days of Let's Talk and what prompted you and John and that amazing family in Terrain to pull the trigger and do something like this.
Yeah, absolutely. I mean, sometimes these things emerge out of tragedy, and you've got to look for something positive in a tragic experience, and that was definitely what happened with the suicide of young Sam, that the family just wanted to do something. They could see the need. They knew one of the biggest barriers was stigma and the attitude that we have as a community towards people with mental illness, and it kind of links in with what we were talking about with Brierly before. The mission is to really break down that stigma, to really promote help-seeking behaviours, and to be okay with talking about when you're struggling. I think that's one of the challenges. We have a sort of stoic attitude, and particularly in rural communities, I think that's even higher, where people are less inclined to talk about it because small communities, everyone hears everything. So, I admire people like yourself to get out there and just normalise this experience. It's a health issue.
Yeah.
And so similarly with drug and alcohol, it's a health issue, and people don't want to talk about those issues because of stigma and shame. So I think the model of Let's Talk has been great, and I think it's had a really positive footprint in the community. A lot of people seem to know about it now, which is kind of a credit to the family and to John right back at the start to persist when, I guess, it would have been easier just to go away quietly and grieve and all that sort of stuff, and they said, no, we've got to do something, and they did. And
I think, you mentioned that stigma that's associated with it, and, mental health for mine, it's a chronic illness. It's something you have to live with for the rest of your life. You're not going to ever get cured. You're going to have bad days, just like anyone that has a chronic illness, cancer, heart conditions, kidneys, you've just got to manage it. And obviously you have to be able to, I guess, be prepared to know that you're always going to be dealing with it, and it's how you deal with it is what's going to make the difference. But Let's Talk, I guess, the way that you've taken the message out to the community and not just here locally, right around Australia and into Tasmania. I'm going to get to Tassie very, very soon. But I think, it's spread very rapidly, and at a time when I think it was most crucial to start, raising that awareness that our communities are affected by mental health stigma.
Oh, and particularly back in 2016, we saw a higher than state average loss of life to suicide, and so there was definitely an emerging need, and I think we've been able to see a positive impact in that. One of the comments I was going to say earlier, saying that around mental illness is, it's a lifetime diagnosis, but it doesn't have to be a lifetime of sickness.
No.
And so doing the things like you're talking about, positive self-care, taking treatment, getting involved and, doing other things that help promote good, positive mental health, they're the sort of things we do that reduce the times or the experience of illness. But you're right, we can't control the whole course of it, so we're going to have lapses and relapses.
B&B Furniture Plus now stock a range of adjustable beds. They have mobility aids to help you live your life to the fullest, and lift chairs for the best in comfort. B&B Furniture Plus is locally owned at 203 Lava Street, Warrnambool.
Aqualife Pet and Aquarium is the most unique pet store in the southwest. Where else can you purchase beautiful hand-reared birds like Cape parrots or red-tailed black cockatoos? If birds aren't your thing, then maybe it's the bearded dragons, the pet snakes or the stingrays that interest you. The team at Aqualife Pet and Aquarium have the knowledge to keep your pets happy and healthy for life. From rabbits to exotic tropical fish, reptiles and birds, there's no place like Aqualife Pet and Aquarium. Bell's Garden Centre has the largest range of sand and soil products in the southwest. People choose Bell's because you can't buy experience, and Bell's has plenty. With bulk product delivery available across the southwest, for your next project, it's gotta be Bell's.
And you know, you've seen annexes of Let's Talk in Colac now open up, Hamilton. I know Abby Power has done, pardon the pun, a power of work to be able to get you know, things up and running. I know Sheepvention's got a concert and a mental health discussion panel, which I'm a part of on Sunday. You know, everyone just seems to be a lot more open to it, and even people I've spoken to saying that I'm going to be talking at this event on Sunday. They're just going because they probably have, you know, they want to hear other lived experiences, and I think that helps. I think, you know, to be able to hear from someone that's going through it certainly does help. But you and John Parkinson, a couple of years ago now, I remember it very, very vividly, decided that you were going to go and ride a Postie bike around Tasmania to spread the Let's Talk message. It was a very interesting way to do it, but it was very fulfilling. Just explain your Tasmania trip.
Well, I guess the metaphor of why we did it on Postie Bikes is sending a message.
Yep.
And so there was that. There was the other thing about Postie Bikes. If you've ever ridden one, they don't go real fast. And if you've been around Tasmania, it's a lot of hills. So
yes.
Honestly, at times I thought I could ride a push bike faster than we were going up some of those hills. But it did really teach us to slow down.
Yeah.
And appreciate what's going on around you.
Yep.
And I think we live a really fast-paced life. We're hit with stimulation from all sorts of things, mobile phones, smart watches, everything's going bing in this day and age. So to get out there and to just putt around, the bikes were a great lure for people to come and talk to us. Mm-hmm. People would see the Let's Talk, because we walked around in the wind cheaters and everything, and they'd see actually more than wind cheaters. We had coats on,
I was going to say multiple layers.
In some parts we were ridiculously cold, but that's okay. But they'd see the Let's Talk and they'd say, let's talk, and just come up wanting to have a joke, and then they'd say, once they found out what and nearly everyone we spoke to had a lived experience of a family member or themselves, and it was just a great door opener or conversation opener, if you like. And that's what I've really liked about the whole Let's Talk movement. We've tried to keep the message simple and you know, and get a logo that people can recognise with, so that it just creates a safe space. Yeah, that person knows something about what this is about.
And you mentioned families of loved ones too. I know that you know, it affects them too. You know, it's not just the person that's dealing with mental health. I know it affected my wife and my mother and my father and my son, he was 4 at the time when I had my breakdown. But I think, I think knowing how to support those who are supporting people with mental health sometimes gets pushed away a little bit. There's a lot of focus on the person dealing with it, but their family, you know, they've got to have a great support network to be able to I guess, you know, make the most of this journey, which is a life sentence. You know, well, again, a life sentence, but something that you can live with. But it affects so many more people, and you know, just you saying that coming across people with lived experience, either as a carer or as a person, that's what it's about too, isn't it?
Oh, and it's one of the things I'm most passionate about is the engagement of family and supportive others, whether that's partners, siblings, parents, or whatever. Because you're right, the service system has still got a ways to go in how we work with families. I think we do a lot to try and invite families to be a part of that journey. Sometimes families don't think it's something they should be getting involved in too. Yeah. And sometimes, particularly in the drug and alcohol world, there is a bit of stigma and shame, and so people avoid seeking help. But we really want to, much like we want people to step out and talk about their own experience, we want families to be more willing to seek help and be involved. There is so many good things that families can learn to do that might just enhance what they're already doing.
And sometimes if you know someone, you know, just show up. Bring a coffee, you know, don't ask if you need help, or don't ask if you know, is there anything I can do? Because 9 times out of 10, you're always going to say, no, I'll be all right. So you've really just got to show up, bring a coffee. And if there is anyone watching this there is help available, and if anything we're talking about is triggering, make sure you contact Southwest Healthcare's mental health team or Lifeline as well. Mark, I do want to start to talk a little bit about what you're doing currently with WRAD. Again, affiliated through family with WRAD for many, many years. My dad worked there with Jeff and you, and I've seen, you know, the amazing work that organisation's done from the get-go. But the big focus really has been residential rehabilitation, and we've spoken a lot about stigma surrounding mental health, and you've touched on alcohol and substance abuse illness. We need a residential rehabilitation centre down here, don't we? And it just beggars belief that we still haven't been able to secure one when there's facilities in other parts of Victoria that are really, really successful.
Yeah, absolutely. We're the last region now in the state to get a residential rehab, and that's what we've been pushing for, as you know, for a lot of years. I think take a lot of pride in what WRAD deliver as a service in terms of integrated care. So we have the bulk billing medical practice, we have the psych registrars on site, we have a psychologist there a day a week, we have the clinical team that are delivering a range of clinical interventions for AOD in a community-based setting. What we don't have is a residential stay. For some people, it is hard to make the change. Dealing with addiction is a really challenging space for some people, and so the idea of being able to get into a residential facility where you're away from all those triggers and stimulus that in your environment gives you an opportunity to have a clear head, to learn the skills you need to learn to make positive lifestyle change. That's why we would argue for a residential rehab there. It's an evidence-based treatment approach that we just don't have in the southwest. So if you're struggling with dependence and needing to seek that kind of more intensive level of care, the only options are to go out of area. And one of the things, going back to why I'm really passionate for this to be on country and in our region, is not only for First Nations people to be doing it in a safe, culturally safe environment that fits with their culture, but also for a mainstream service like us to provide that wraparound care to the family, the support system, so that when that person leaves that environment, they're going into the support system are more engaged, more aware. They've had a chance to be a part of that treatment journey because it's happening locally, as opposed to having to ring a phone line down in Melbourne to see how your loved one's going. There's capacity to do all of this stuff on site and in region.
I agree, Mark. And just one thing that I want to touch on is our park facility here in Warrnambool. I was lucky enough to spend a month there myself, mid to late last year it was. Again, not necessarily drug and substance abuse, but mental health. But I think the model's the same. It's the chance to remove yourself from the community, to, I guess, reset yourself 100% completely, to reprogram the way your brain is used to. But one thing I loved about Park was that while I was staying there, I could see my wife, I could see my mother, I could still have some mates come and catch up with me. I was able to leave if I needed to. I wasn't locked in, you know what I mean? But I also had that safe space that if I did have another episode or something like that I was able to do that. So having been in not obviously a drug and alcohol abuse facility as such, but something that follows that residential model, it is really, really effective. It takes a little while to get into it because I know it took me probably a good couple of weeks for me to go, right, I'm buying into this. But I just would hate to think about what I would have done when I didn't have that facility and what other people that don't have that facility have got access to and what it can do to help recovery.
Jump in there too, Liam. In that first 2 weeks when it was a bit wobbly, I'm not sure whether I want to stay, I want to go. You imagine yourself being, 300 or 400 kilometres away from family, having those wobbles, you're likely to walk out. But if you're getting those wobbles and you're still in your region, we've got a chance to reassure you, work with family, whatever might be needed, that can help that person stay in the program. But you're right, it's a voluntary program. They're all voluntary. We can't force anyone to do it. But I believe we'd have a greater chance of a success rate. One of the things we do know with the residential rehabs, they do have a fairly high dropout in that first 4 weeks, and that's why we want to have one where we can do more about that.
And I think, just on that note, there's people that drop out, but, within 6 months, I think people can come back.
Exactly.
There's not a, once you're out type approach there. I know I was always...
You're not blacklisted.
Yeah, that's correct, which is great. But so where are we at now with the Lookout project? I know, we're getting close to a state government election next year. The budget's away. I'm like you and the rest of the committee probably. I just get so frustrated when I see that we've missed out on funding for something like this again. Where's it all been since the last state election?
So there's been a lot of really exciting developments now with a lot of work with Eastern Mar and the 4 ACCOs in our region. We've developed a model of care that is really culturally safe and culturally appropriate, trauma-informed. So we've got, and that's been seen as a good model to take forward for what a residential rehab would look like. So that's been given a tick, and it's now working with an architectural firm and with local government and other government departments to try and secure the land. That's still our biggest challenge, if we can identify the land and sort of somewhere between the 5 to 10 acre within a reasonable proximity to services, so not too far out. Once we get that, I think we've got a really good chance of going that next stage. But I'm pretty excited. We've had a lot of really good feedback about the model. It is more innovative. It's, as I say, because it brings in that cultural element, we're looking to do things, and our partnerships with Deakin and Southwest TAFE to give people a career pathway, not only for the people that are in the program, but also for staff and for fostering new workforce by giving placements and opportunities for people that are studying, say at Deakin or at Southwest TAFE, could come and do placements in the resi rehab. So we think this is a great benefit to the community. It's great benefit to the people that are struggling with substance use and can't access services, and for those families, but it's also got an overall community benefit as well. The more people are getting treated, the less problems we're going to see. And
I think one thing going back a few years ago that particularly upset me a little bit was there was a little bit of backlash from the community about we don't want it in our neighbourhood, we don't want it here, we don't want something like this. That's that stigma you're talking about, and I go back again to the park example. Obviously different symptoms, different treatment. But in a residential area, off Moore Street, and completely safe. There was no. From my knowledge, when Park was first announced, I don't think there was any fear that a mental health facility was being opened up. Brierly was there, so it was obviously something. But I just wish that people that were objective then could look at the Park model and look at myself and go, well, they affiliate me with media, they affiliate what I do, but I stayed there. There's a lot of people that, are probably very similar that need somewhere like this. Yeah. And they're well looked after.
Absolutely. And I think that's the thing. There's a lot of myths and hysteria that went around with the previous site location that we had, and I think that was really unhelpful. It also probably pushed people away from seeking help too, hearing these kind of community attitudes. And it was only a small part of the community that were voicing those things. As you're aware, we've raised a significant amount of money out of the community, so there's a broader community support for it. And we need to break down that stigma. And one of the things that I'm really keen, wherever residential rehabs have gone, there's always been a bit initial angst and worry, but there's never been any of those worries ever come to fruition, if you like. And I think that's the thing. We need to have it here to show people it's okay. People getting help are not the people you worry about.
Absolutely. And have you found that our politicians, I know Roma's a massive advocate for what we're doing. Have you got some extra bipartisan type support from both sides of government?
Absolutely. And that's, I think, what led to us getting the grant to help with the feasibility. So I think there is definitely a need and a recognition within government that this is a facility that's required for this region. And it's probably, from what we understand, we've just been missed out by things like COVID and a
Yeah.
few other things. And as you know, the budgets
Yeah.
or the financial state of the government's more challenging.
So no doubt in the next 12 months we'll be starting to hear the drums beating again to try and raise some awareness about it.
Yep, absolutely. No, we're not going to take the foot off the pedal.
Yep.
RAD's been committed to getting a residential rehab here for 10 years, and we will maintain that commitment until we can actually celebrate it being put in place.
I can't wait for that day. Just finally, Mark, before we wrap up, WRAD Health in general. I know back in the day it was just WRAD, but now it's WRAD Health. How far RAD's come as an organisation since I first become aware of it through my father working there. Medical practitioners, bulk billing, it sort of goes by the wayside a little bit, I think, with that awareness of how much fantastic care is available at RAD. You must be, as the new CEO, and obviously passed on from Jeff, who did a fantastic job for many, many years.
Absolutely.
The organisation's just something we're really lucky to have here, isn't it?
And that's the message we really want. This is a community organisation. This is for the community, and we are doing some amazing things. As you say, being able to deliver a bulk billing practice that has Deakin medical students come and do placements, hospital medical officers come and do placements. So we're breaking down those attitudes, because all those new career people are learning that working in drug and alcohol is actually not as scary as I thought it would be.
Yep.
We have a fantastic clinical team that are delivering, as I said before, the full range of from youth, adult, dual diagnosis, rough sleepers, homeless programs. We have day rehab programs. We have a really solid team doing some amazing things and getting some great outcomes too, which I think further fosters why we should celebrate this organisation as a community. And more recently with partnerships with Southwest Healthcare, having psych registrars on placement, because I'm not sure how much the community know about the co-occurrence of mental illness and substance use, but it is quite high. So having services that can do this, diagnosing, screening, assessing. We have a psychologist there one day a week who's really got a passion for neurodiversity, and that's something that's coming out more, that we're starting to understand more. So there's a lot of exciting things happening within RAD at the moment. And I think the other one that I just want to put a plug in for is the family and care engagement. We, again, as I was saying, families and carers often suffer this stuff in silence, don't seek help as early as they could. And we really want to encourage people to come and talk to us. And we do now have a stand-up triage process, so people can just walk in the door and talk to someone to just get a sense of where do I need to go.
And that co-occurrence you mentioned, some people that have mental health concerns don't know how to look after themselves, so they turn to drugs and alcohol to try and, I guess, numb the pain a little bit. But it always ends up not going the way you want it to, and it leads to another bunch of issues. So, like you mentioned, to have a facility that works so closely hand in hand with Southwest Healthcare, and we see it at the moment just with the doctor shortage and so much that's going on around here. Warrnambool's absolutely rife with influenza at the moment, and the more places we've got where we can turn to for health care, the better, I think.
Absolutely. No, and that's RAD really want to be seen as that kind of service in the primary healthcare sector, to be this accessible service with chronic and complex needs. But and that's part of our ongoing mission, to try and build a bit more capacity in the organisation to deliver those programs.
Well, Mark, thank you very much for coming on Good Chat. It's good to have a bit of an overview of the man, and obviously so much stuff that you've been able to do and continue to do for our community. And as I've said, if anyone is affected by anything we've spoken about today, there is help available. RAD Health, Southwest Healthcare's got a fantastic mental health team, and of course Lifeline and all of those areas. This has been Good Chat. Thank you for your company, and we'll see you next time.